Good morning. My name is Priya Hill, and I'm a student researcher at the University of Louisville Department of Surgery. And today I'll be discussing our research on whether fine needle aspiration can be avoided in patients with large, symptomatic, or minimally suspicious thyroid nodules. While total thyroidectomy is a standard treatment for thyroid cancers 4 centimeters or larger, and FNA is generally recommended for nodules 2.5 centimeters and up, the accuracy of FNA can actually decrease in larger nodules. We hypothesize that for patients with symptomatic or substernal nodules without highly suspicious ultrasound features, FNA may not significantly influence their treatment plans. Our study's aim was to assess the influence of preoperative FNA on management plans for large thyroid nodules, specifically those that are symptomatic, substernal, or have highly suspicious ultrasound characteristics. We performed a retrospective review of patients with solid thyroid nodules 4 centimeters or larger, seen by a single surgeon at a tertiary referral center over a 24-month period. We reviewed patient charts to assess clinical decision-making, including the use of FNA and its impact on their management. We also collected and analyzed demographic, clinical, cytological, and pathological data. Patients with a history of prior total thyroidectomy or ipsilateral thyroid lobectomy were excluded. Out of 177 patients with thyroid disease, 41 had nodules 4 centimeters or larger. Among these patients, 75.6% were symptomatic and 70.7% had substernal extension. All of these patients were indicated for surgical intervention. The most notable finding was that FNA only influenced management in 2 out of the 41 patients, which is just 4.9%. Neither of these patients were symptomatic or had substernal extension. Furthermore, FNA results did not alter the management for any of the symptomatic or substernal nodules, which surgery was already recommended. In conclusion, our findings show that FNA minimally influenced the management of patients with thyroid nodules 4 centimeters or larger, affecting less than 5% of cases. This was particularly true for symptomatic or substernal nodules, where the FNA results did not change the recommendation for surgery. Further multi-center studies are needed to validate whether FNA can be safely omitted in these specific patient populations. Thank you so much for your time. We look forward to discussing this work further at the in-person session.